Hi, everybody. Today I'm going to talk a bit about depression uh, because it is very much prevalent in everybody's life and in today's world. Everybody has undergone through depression at some or the other stage of his or her life. So, what is depression? Depression is a persistent feeling of sadness and the lack of interest in daily physical activities or the daily activities for a period of greater than 15 days. To describe it in one phrase, it can be described as a feeling of hopelessness, worthlessness, and helplessness in an individual. So, what is the basic mechanism behind depression? There are neurotransmitters in our brain, and depression is caused by the decreased levels of these neurotransmitters as serotonin, dopamine, and the similar such neurotransmitters. So, the level of neurotransmitters decreases in brain in severe depression from the normal optimal levels. So, in case a person has depression, what he may feel or what may be the signs and symptoms of depression. So, a person may feel persistently low mood or sadness. He may experience headaches. He may experience body aches. He may get persistent suicidal thoughts, then persistently forgetting things, not able to concentrate on like matlab reading, writing. Uh, his appetite may be decreased, leading to weight loss. The other spectrum regarding appetite is the person may have also increased appetite, leading to his weight gain. So either of them can happen in depression, and a person may not be able to sleep at night. He may not be at peace with himself. So these are some of the things a person may experience if he has if he is undergoing through depression. So what are some of the causes which may lead to depression? One of the main causes of depression is certain life events, certain saddening life events, such as the loss of somebody dear or beloved one. Then the other may be mental, sexual, or physical abuse sometime in childhood, which may give rise to depression later in life. Then substance abuse, such as drugs, such as amphetamines, cocaine, heroin, and also alcohol abuse causes may be a cause of depression. Alco- Depression is very much common in young population as well as elderly population. Then repeatedly thinking negative thoughts and thinking over and over again may also lead to depression because of the negative mentality and the negative thinking and persistently thinking negative thoughts. Then, in as far as female gender is concerned, postmenopausal depression is also prevalent. Past 45 years of age, when the women have which is the postmenopausal age, women may experience mood swings as well as depression, and this is very much normal. Then physical diseases, because the mental health and the physical health are interconnected. So the physical diseases may adversely affect the mental health. Then some of the physical diseases also have depression as the intrinsic part, such as hypothyroidism, hyperparathyroidism. So these are some of the factors which may cause depression. Then, as far as sex is concerned, females have more preponderance for depression, and then also age. As I told you earlier, also young as well as elderly population is more predisposed. So, just in case we have a feeling of depression, what could be done? First of all, if the depression is you are in the earlier days of depression, counseling may help. Counseling by your near and dear ones, or maybe say a psychologist, that may help out. In the elderly population, if they have depression, they can like matlab thinking of old and fond memories, repeatedly thinking about them past which were in the past. They can remember them, and this may induce a feeling of certain happiness, and particularly in the elderly population. Then physical activities, let me tell you, physical activity like exercise and running, walking, and all such things, they lead to the release of certain chemicals which may induce happiness. Exercise also may be like practiced to come out of depression. Then meditation and yoga. These two are very important tools to come out of your depression. And just in case your depression is getting very severe, you are not able to get out of it despite counseling and by your own motivation, then you can anytime take help of antidepressants, because as I told you, it's not it's about your mind, the feeling of sadness, but it also affects your neurotransmitters, and the level of neurotransmitters goes down in depression. So to bring them back to normal optimal levels, antidepressants are very helpful, and you should anytime take the help doctors your doctor's advice, and the take the antidepressants which it prescribes. There's no harm in that, and hopefully you'll be fine with the medication, counseling, and maybe practicing a few of these such things. Hope this video will be helpful for you. Uh, Thank you.